The increase in the risk of premature death that we see with loneliness and isolation, with social disconnection, is on par with what we see with smoking daily, even greater than that which we see with obesity.
A startling new report and warning from the U.S. Surgeon General today. Dr. Vivek Murthy says the country is facing a new health crisis. Loneliness, and he is calling it the latest epidemic to impact Americans, and it is having a devastating effect on a person's health.
ABC's chief medical correspondent, Dr. Jen Ashton, here today to talk more about this. Jen, this sounds like a perfect topic to just kick off Mental Health Awareness Month. So what is behind what is some people are calling an epidemic of loneliness?
Well, I think we don't know. It hasn't just been starting since the pandemic, but when we had Dr. Murthy on GMA3 today, his team was working on this report for over a year, and he has raised this to, a priority level for what he's trying to tackle in terms of public health in this country. Remember, you don't have to be alone to be lonely. And I think that part of what was revealed in this report is that this is now on par with being sedentary, smoking, in terms of a risk to our physical and cognitive health. So now that we've identified it, I think we can tackle it head on.
So I don't mean for this to be an oversimplified question, but we all get a little lonely at certain points in our life. So how does a person recognize, like, I'm at a point where I really need to pay attention to this?
Well, I think that's a good question, and I think it's going to be a little different for everyone. But what the Surgeon General really pointed to are these screens, right? We can tend to think that it brings us together and increases our sense of connection. But in reality, we need that human-to-human contact in part. And I think that there's a lot of overlap in terms of the symptoms of loneliness that can also mirror depression and anxiety, stress. So I think it's not an easy diagnosis to make, but bringing our attention to this, that we all need it, that can affect people of every age group, every socioeconomic background, super important.
It is very complicated. I'm an only child, and I actually grew up enjoying my alone time because you get to that stage in your head, but I never felt lonely in my life. And so I'm wondering, as a parent, how do you negotiate to determine whether someone is needing an intervention or needing help? Do they have to say, I'm lonely, for that to happen?
No, I think it's, open-ended questions. It's making astute observations. It's also taking steps, just like we do with some of our physical health practices, to try to prevent loneliness, reaching out to people 10 minutes a day, and not via text or email, but so you can hear the person's voice. Better yet, so you can see the person. Those kind of things are very important. And then service. The Surgeon General talked about service to others actually can be very protective against our own sense of loneliness.
My concern is because of the pandemic and all the kids who were forced to rely on their phones for a connection, that we haven't seen really the fallout, because they've kind of gotten used to that level of loneliness.
That's right.
That's
right. And we also, you mentioned children, you both mentioned children in the pediatric population. We also need to do better for the older population and elderly. We need to do a better job of bringing those generations together.
I say we all have a big party right now.
That would work.
Let's get together.
That would work.
Start it right here on First at 4.
Perfect.
You lead the way. Thank you, Jen. It's always a pleasure having you on here.